right, perfect. Just gonna set this up. All right. So, before I go into the patient's room, I am reviewing the patient's chart, looking over the doctor's orders, and I have provided my hand hygiene. So I'm going to knock, go in, introduce myself. Hi, my name is Gabby, and I'm going to be your nurse today. And I've been ordered to do a basic head-to-toe assessment on you. Is now an okay time for you?
Sure.
Okay, perfect. So first thing I'm going to do is I'm going to pull the curtain to provide privacy for my patient. So then I'm gonna verify your full name and your date of birth. Okay, go ahead and start.
Brandon Brown, 12/9/93.
All right, perfect. And do you know where you're at today?
The doctor's
All right, and what brings you in?
yearly checkup.
All right, perfect. And do you have any medication allergies, environmental food allergies?
Nope.
All right. In the last year, have you had any new injuries, illnesses that need to be reported?
About a year ago, I had a synovial sarcoma removed from the leg abdomen area.
Okay. And were you treated for that? Okay. And then do you have any pain or discomfort around that site? Okay. And do you have any pain right now, today?
No.
All right. So, since you didn't report any pain, I'm not going to run through the PQRST questions. But if you were to be reporting pain, I would run through the PQRST questions to further assess, okay?
Okay.
So, you are alert and oriented ×3 to person, place, and situation. And your mood is appropriate for the situation that you're in. And your facial expressions are appropriate, relaxed for the situation. You have no involuntary body movements. You appear to be in a relaxed position. Okay. And you're clean, well-groomed. Do you have any questions for me?
Nope.
Okay. Perfect. So, the first thing that I'm going to do is I am going to assess your general appearance of your head, okay, and your face. So if I can, I'm going to have you take your hat off. In the last year, have you had any injuries to your head?
Nope.
Have you had any previous surgeries on your head?
Nope. Any
reports of headaches?
Nope.
All right. Have you noticed any changes with like lumps or bumps, hair loss, anything
Nope.
like that? Okay. So generally appearing, your head is round, it's normal, symphatic, symmetrical, and your face is free of any lesions, edema. There's no weakness on either side, and your skin is dry and intact. Okay. And I see that you have a beard and a mustache. The hair is evenly distributed on that. All right. Now I'm gonna I'm gonna palpate your head, so I'm gonna just kind of feel around on it for any lumps or bumps, and I want you to report any pain or tenderness that you have. Okay.
Yep.
All right. So also, looking, your hair is obviously brown. Your hair is evenly distributed. Just looking at your head, there is no visible lesions on your scalp or abrasions. There is no palpable lumps or bumps. There was no visible parasites. And did you have any pain or discomfort?
Nope.
All right, perfect. So then I'm gonna feel your TMJ. Okay. So how I assess that is I'm just gonna push right on that joint right in front of your tragus. Okay. And then I'm gonna have you. So I'm gonna push, and I'm gonna have you open and close and open. You go side to side. Perfect. Did you have any pain or tenderness?
Nope.
All right. And there was no clicking or popping, crepitus noises noted during that TMJ assessment. Okay.
Okay.
Now I'm gonna assess cranial nerve number 7. So how I test that is I'm just gonna have you smile at me and frown and raise your eyebrows and puff your cheeks. Perfect. Cranial nerve number 7 is intact. All right. And now I'm going to test cranial nerve number 5. And how I test that is I am going to do the sharp and dull test, okay? So I'm going to take this paper clip and I'm going to push, all right? And then this is going to be the dull, okay? I'm going to have you close your eyes and I'm going to run on 3 sections of your face, okay? And you're going to tell me what sensation you feel, okay? Go ahead and close your eyes.
Sharp, 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 dull, dull, dull.
Perfect. So following that, cranial nerve number 5 is intact. Okay. So now your eyes. Have you in the last year noticed any changes with your vision? Blurriness, floaters,
Nope.
any sensitivity to light?
Nope.
All right. And have you ever had any injuries to your eyes?
Nope.
What about any previous surgeries?
Nope.
Okay. And do you use any corrective lenses such as glasses or contacts?
Nope.
All right. Perfect. So first thing is I'm just going to generally look at your eyes. I see that your eyebrows and your eyelashes are all evenly distributed. Your cornea is clear. Your sclera is white. And then I'm going to have you pull down on up. And your conjunctiva is pink, moist, free of any edema, inflammations, or lesions, okay? So that's good. And have you had any dryness with your eyes that you're concerned about?
No.
Okay, perfect. So I'm just gonna measure your pupils bilaterally just to get the general measurement of your pupils. Okay. Perfect. Perfect. So your general pupil size bilaterally is about 5 millimeters, so that's normal. All right. And now I'm gonna perform the Perla test. Okay. That is, I'm gonna shine a light into your eyes bilaterally, and just to test to see how they react. Okay. And you said you have no reports of sensitivity to light.
No.
All right. Perfect. So I'm gonna just come in, have you look at me. Perfect. Alright. So your eyes bilaterally are Perla, which means that they are round, both reacted to the light and accommodated. Okay. Now I'm going to have you look at the wall. And now I'm going to look at my pen light and follow all the way in. Perfect. And now I'm going to perform the 6 cardinal gaze, okay? So I'm just going to have you follow the tip of my pen light in all 6 locations, okay? Alright, so following your assessment of your eyes, your pupils did constrict and converge bilaterally through those exams. And all cranial nerves 3, 4, and 6 are intact, okay? Now, I do have to test cranial nerve number 2 by performing an eye exam with the Snellen chart. So how that is, I just have you read off the letters for me.
A, C, E, G, H, J, L, M.
Perfect. So cranial nerve number 2 is intact, no concerns, okay? So now we see your ears. Have you noticed any decrease in hearing?
No.
Do you use any hearing devices?
No.
Have you had any surgeries previously on your ears?
No.
All right. And as a child or as an adult, frequent ear infections?
No.
Okay. Any concerns with pain?
No.
Okay. Perfect. So first thing is I'm just kind of inspecting your ears. Just looking at your ears, they are symmetrical to your head. Your ears are symmetrical in size and shape. Your top of your ears line up with your outer canthus of your eyes. And there is no visible lesions or inflammation of your ears or drainage. Okay. All right. So now I am going to just push and palpate around your ears, and you're gonna report any pain or tenderness that you have. Okay.
Okay.
So the first thing is I'm gonna push on your tragus, pull on your pinna, and then I'm going to push behind on your mastoid process. Did you have any pain or discomfort with that?
Nope.
All right, perfect. All right, now I just have to look inside your ears, okay? So how I do, I'm just going to come around with my light, shine, okay? So, all right. All right, perfect. So, your ear canals bilaterally are clear. Your tympanic membranes were like a pearly gray. All right, the sternum, so the wax in your ears was like a honey color yellow. There was no evidence or of perforation of your ear canals. Okay, perfect, good. And you said you have no reports of like decrease in hearing or anything?
Nope.
All right, so I am going to test cranial nerve number 8. How I perform that is by using the whisper test. So how that works, I come behind you. I'm gonna have you close one ear at a time. I'm gonna whisper 3 words into each ear. All right, and then I'm gonna have you repeat those words back to me. Okay?
Yep. Makeup. Notebook. Laptop. Football. School. Handbook.
Perfect. So, following the whisper test, your cranial nerve number 8 is intact. Okay. In the last year, have you noticed any changes with your smell?
No.
All right. Have you noticed any excessive congestion or drainage? All right.
No.
And have you ever had any injuries to your nose?
No.
All right. And what about any surgeries?
Nope.
Okay, perfect. So, just looking at your nose, it is symmetrical to your face, and it is free of any edema or lesions. Okay. All right. So now I am going to take a look inside your nose, if you don't mind. Tip your head back for me. Perfect. So, following your examination inside your inner canals, they were pink, moist. There was no deviation or perforation of your septum. All right. And then I am going to test cranial nerve number 1 by using the sniff test. So I will have you plug one side of your nostrils at a time. I'm gonna put something under for you to tell me what you smell, okay?
Okay.
Alright, so close your eyes.
Coconut.
Perfect. Close your eyes and do the other side.
Strawberry.
Alright. So, cranial nerve number 1's intact, and bilateral, your nostrils bilaterally were patent. So clear, okay? Now I'm gonna feel on your sinuses, your frontal and your maxillary, and I want you to report any pain or tenderness that you have, okay?
Okay.
Any pain or tenderness?
Nope.
Alright, perfect. Alright, and now in the last year, have you had any new dental work in your mouth?
Nope.
Okay. And have you noticed any changes with like swallowing, any weakness on either side?
Nope.
Alright. And any pain?
Nope.
Okay. Have you had your tonsils or adenoids removed?
Nope.
Okay, so no previous surgeries on your neck or throat?
Nope.
Alright, perfect. And no changes with your tongue, no, your taste is still Normal?
Yep.
Okay, perfect. So just generally looking at your lips, I see that your lips are pink and moist, free of any lesions or edema. Alright, so that's good. And now I am going to just have you open up for me, and I'm going to have you say, ah, stick out your tongue. Perfect. So your teeth were all present with no visible dental work. Your gums and oral mucosa was pink, moist, free of any lesions. Alright, and your tongue was also symmetrical. It was also pink, moist. There was no abrasions or lesions or edema of your tongue. Okay, your uvula rise midline. Alright, and also your tonsils were measuring about a 2+. So all within normal range. Okay. And then do you have a gag reflex?
Yep.
Alright, perfect. And can I have you say light, tight, dynamite?
Light, tight, dynamite.
Alright, perfect. So, indicating that following those tests, cranial nerves 9, 10, and 12 are all intact. Okay? So now I am going to just kind of examine your neck area. Is it okay if I feel around? Do you feel comfortable?
Yep.
Okay, perfect. So you said no pain or tenderness in your throat and neck area.
No.
Do you have any thyroid conditions?
No.
Okay. Alright, so I'm just going to have you swallow for me. Perfect. Alright. And then, so your trachea is midline. And now I'm going to assess for JVD. Alright, so just to do that, I just have to place you at a 45-degree angle, okay? Just to assess for that. So I'm going to have you at a 45-degree angle. I'm going to have you turn your head. Yep. Perfect. Alright, just sit back up for me. So there was no JVD noted. And then I am going to assess your carotid pulses, okay? One at a time. Do you have any concerns with that?
Nope.
Okay. So I'm just going to come out. Alright, so your carotid pulses were 2+ equally bilaterally. So that's within normal range, okay? Now I'm gonna listen for any bruits in your carotid, okay? So I just have to listen with my stethoscope. Alright, so everything sounds clear. There was no bruits noted in your carotid. Alright, now I'm going to palpate and feel around on your thyroid, okay? Just for any lumps or bumps, alright?
Okay.
And you're going to report any pain if you have any, okay? Alright, now I'm going to just come around back. And have you sit up just a little for me. Alright, now I'm going to have you turn your neck just a tad so I can get the back side. Perfect, and the other side. Perfect. So your thyroid was non-palpatable of any lumps or bumps, masses, okay? Did you have any pain or discomfort?
Nope.
Okay. Now I'm going to assess your lymph nodes, okay? There's 7 of them that I'm going to feel for. I want you to report any pain or tenderness you have with them, okay?
Okay.
So first one I'm feeling for is your pre-auricular. And then right behind it, your ear or mastoid process is your post-auricular. And then I'm gonna feel your occipital. Alright. And then maybe lift your chin up just a little bit. Your submandibular. Your submental lymph node. And then I am just going to have you shrug your shoulders up for me. Perfect. Alright. So all your lymph nodes were non-palpatable. Alright. Normal. Perfect. And then, did you have any pain or discomfort?
Nope.
Alright. Have you noticed any decrease in range of motion of your neck, head? Okay.
Nope.
So I'm just going to have you shrug your shoulders up. Good. You have good upper strength in your neck. Okay. And then I'm going to have you push against my hand. Perfect. Perfect. Now I'm going to have you turn side to side. And then can you make a circle with your neck? Did you have any pain or discomfort?
No.
Alright, perfect. And you have full range of motion of your neck. There was no crepitus noted with assessing your range of motion of your neck, okay?
Okay.
So I'm just going to assess your upper extremities, okay? So if you don't mind, I'm just going to roll up your sleeve. Okay, I'll do the same thing. Perfect. Alright, so, in the last year, have you had any injuries to your arms?
Nope.
Have you ever had any prior surgeries?
Nope.
Have you noticed any numbness or tingling in your hands, arms?
Nope.
Any pain or discomfort in your joints?
Nope.
Unusual swelling?
Nope.
Okay. So I'm just kind of looking at your arms, inspecting them. I do see that you have bilateral tattoos on your upper arms. Looks like one is like a tribal band, one is like a chain sprocket. Alright. I see that there is no visible lesions or edema. Your skin looks dry, intact. And then I am going to just feel your arms with my back of my hand for temperature. Your temperature bilaterally on your arms is warm. Alright, and then your hair on your arms is evenly distributed. Alright, so now I'm just going to feel around on your joints, starting at your shoulder, your elbows, and work my way down. I want you to report any pain or tenderness you have with that, okay?
Okay.
Do you have any pain or tenderness?
No.
Any pain or tenderness?
No. No.
Alright. Alright, and then assessing your nails. Your nail beds on your fingers are pink, they're firm, and then I'm just going to test your cap refills, okay? Perfect. So your cap refills on your hands, upper extremities is less than 3 seconds. So that's good. And there was no palpatable edema. So a 0 for edema. Okay. And no pain or discomfort. Alright. There was no cracking, clicking, or crepitus noises noted during palpation. And then I do have to palpate or feel your radial pulse and your brachial pulse, okay? So I'm going to have you turn your wrist over. And I'm going to feel your radial. Alright, and then I'm going to come up here and I'm going to feel your brachial. Alright. So your radial pulses bilaterally was 2 plus equally. And the same for your brachial. Your brachial pulses were 2 plus equally bilaterally also. So that's good. And now I'm going to just check some range of motion of your arms, okay? So the first thing, if I can, I'm just going to have you put your arms out in front of you. Go to the side. Can you make a circle? Did you have any pain or discomfort? Okay, bring them back. Have you flip them over. up, down. All right, flipping back over. Open, close, tip, tip, tip. Perfect. And then I am going to have you squeeze my fingers. Perfect. So you have good strength in your upper extremities. And did you have any pain or discomfort? All right. And you had full range of motion. And there was no clicking, popping, or crepitus noise noted during your range of motion assessment. Okay. So now I'm gonna assess your chest area. So if I can, I'm gonna have you take your shirt off. All right. So I'm just gonna run through some basic questions. The last year, have you noticed any frequent coughs, any reports of reoccurring respiratory infections?
No.
Okay. And any shortness of breath?
No.
Any pain with breathing?
No.
All right. And have you ever been a smoker?
No.
Okay. Perfect. So I'm just kind of taking a general look at you. I see that it looks so your breathing shows that you have no signs of respiratory distress. Your facial expressions seem to be relaxed, so meaning there's no pursed lips breathings. You're not having any difficulties breathing, and there's no use of accessory muscles for breathing. Okay. I see that you have a tattoo center and midline of your upper chest. And then I also see that you do have a pick. Is that a pick line?
Yep.
All right. And is that currently being used?
No.
All right. And did you receive treatment through that previously?
Yep.
All right. Do you have any pain or discomfort around that?
No.
All right. Have you noticed any redness?
No.
Okay. All right. And then your hair on your chest is evenly distributed. Your skin is dry and intact, free of any abrasions or lesions. Okay. So now I'm going to have you, can you stand up for me? So, nope. I'm just gonna have you look at the camera. So the first thing is I just got to percuss over each of your lobes, okay? So you don't have to do anything for this, just some tapping, okay? All right, so your percussion noises were resonant to sound, and I didn't notice any concerns with that, okay? And now I'm going to assess your lung sounds. All right, so first thing is I'm going to have you, so I'm going to assess 8 different locations on your upper chest, okay? And each of those locations are between the 2nd and 5th intercostal spaces, all right? So I'm going to have you take a deep breath every time you feel my stethoscope. If you become short of breath or experience any difficulties with breathing, I want you to let me know, okay? Alright. So your lung sounds were clear. There was no adventitious sounds noted. So no wheezing or crackles heard. So they're clear bilaterally. So that's good. And then I am going to assess your different parts of your heart, okay, in 5 different locations, again, through the 2nd to 5th intercostal spaces, all right. Do you have any history of any heart conditions?
No.
Have you noticed any palpitations?
No.
Okay. All right. Any chest pains?
No.
All right. So I'm just going to take a listen. So the first spot I'm listening at is at your 2nd intercostal space. It's your aortic. Your pulmonic. I'm listening at your Erb's point. Listening at tricuspid. Now I'm listening at your mitral valve. So all S1 and S2 sounds were clear, they were regular, they were not diminished, so that's good with a normal range. And also there was no S3 or S4 sounds noted. Okay, so no murmurs or anything like that. All right, so now your back side, I do have to have you stand back up. All right, and turn around. So just inspecting the back side. I see that your skin is dry, intact, free of any abrasions or lesions. I do see you have a few moles and freckles. Nothing to be concerned about. All have good shape, no abnormalities with the borders of them. But I do want to let you know to make sure that you do follow up with a dermatologist yearly, just to have them look over anything and make sure that you kind of do a self-skin assessment on yourself too. Watch for any changes with any mold sizes, growths, okay? All right, and then I am going to, first thing I'm going to assess is your A&P diameter. So I'm going to just come around, I'm just going to look at you. So your A&P diameter appears to be 1 to 2. And then I am going to test, just check your chest expansion. Okay, so nothing too big. I'm just going to come down here, place my hands right under your lower rib cages, right under your back. All right, and then I'm going to have you take a deep breath. All right, and again. All right, so your chest expansion was symmetrical and equal on both sides bilaterally. All right, and then I am going to check for tactile fremitus, okay? So how I perform that is I am going to place my hands on your back and go down, all right? And as I run down, I want you to say 99 every time you feel my hands on your back, okay?
99, 99, 99.
Perfect. So your tactile fremitus, the vibrations diminished while I was moving downward, okay? And then I am going to palpate your back, all right? So, and if you have any pain or discomfort, go ahead and let me know, okay? All right, so there was no crepitus noted upon palpation, okay? And you had no pain or tenderness. All right, perfect. So now I'm going to percuss again, just like I did on the front. Just tap. You don't have to do anything, okay? All right. So again, all the percussion sounds were resident to percussions. So that's good. No dullness or anything. And now I'm going to listen to your lungs on your backside. So again, I'm going to have you take a deep breath every single time you hear or feel my stethoscope touch your back. I do want you to tell me if you feel short of breath or if you're feeling dizzy, lightheaded, or any pain, okay? So I'm assessing your lung sounds over C7 to T10, and then I'm going to just listen over T6 and T8, okay? Alright. So all your lung sounds and all fields were clear. There was no adventitious noises or sounds. So again, no wheezing, crackles, or concerns, okay? Alright, and while you're up, I do have to assess your spine, okay? So I'm just going to have you bend a little bit as much as you can. Alright, perfect. So I'm just going to run my fingers. Do you have any pain or discomfort?
No.
Alright, any history of any spinal injuries?
No.
Okay. So your spinal was normal. There was no abnormality, so no scoliosis or curvatures of your spine, okay? Alright, so you can have a seat if you want. Alright, so now I'm gonna assess your abdomen, okay? So, currently, are you having any pain? Okay. And you said that you did have surgery, correct? You had a synovial sarcoma removed.
Yep.
Alright, so I do see that scar visible. It is midline in your abdomen. Okay. And you have any pain or discomfort around that incision site?
No.
Okay. And any injuries to your abdomen?
No.
Okay, perfect. And in the last year, have you noticed any changes with your appetite, any nausea, vomiting, any
No.
acid reflux? All right. And how would you say your diet is?
Pretty healthy.
Okay. And also, can you we're going to talk about your bathroom uses or,
Pretty normal.
yeah. So, bowel movements, would you say, how are they? Regular?
Yeah.
Okay. When was your last bowel movement?
Today.
Okay. And how would you say that their consistency is?
Normal.
Okay. All right. Do you have any pain with bowel movements?
No.
Have you ever noticed any blood or
No.
mucus?
No.
Okay. Perfect. And do you take any medications for either acid reflux or...
No.
Alrighty. And then what about urinate? Have you noticed any frequent urination, any burning?
No.
Alright. Any hesitancy?
No.
Alright. Any straining with urination?
No.
Have you ever noticed any blood in your urine?
No.
Okay, perfect. And then I do just kind of want to see during your diagnosis with that synovial sarcoma, how did you handle that stress?
Try to exercise.
Okay. Alright, so just a few pointers that I can kind of give you too, to help with stress as well. Like you said, maintain a healthy diet, maintaining your exercise, learning different relaxation techniques, breathing techniques, okay?
Okay.
Alright, so I'm going to have you lay down for me. Alright. So, your abdomen appears to be round. There's no visible masses or lesions. Alright. The hair on your abdomen is evenly distributed. There's no discoloration of your abdomen. Your skin color is appropriate for your ethnicity. And I see that your umbilicus is midline to your abdomen, and I see that your incision site, like I said, is symmetrical to your abdomen. Okay. The first thing is I'm gonna listen for your bowel sounds. Okay. So you don't have any pain or discomfort in any quadrant, right?
No.
All right. Alright, so your bowel sounds are normal active. Alright, and I also assessed your respiration rates while I was assessing your bowels. And your respiration rate was at 16. Alright, and then I am going to just feel there is no lifts or heaves noticed at your mitral and your fifth intercostal space. Okay, and then I'm also going to just check your skin turgor. Okay. Alright, perfect. So your skin turgor is good. There's no sign of dehydration. Okay. Now I'm gonna percuss just like I did on your upper chest and your back. You don't have to do anything. I just want to percuss, okay? Alright, so all your percussion sounds were generalized tympani in your abdomen. Okay, and then I am going to palpate your abdomen, okay, for any lumps, bumps, masses, any pain or discomfort that you have, okay? Alright, and then I'm gonna just palpate your bladder, okay? Alright, perfect. Alright, so there was no lumps or bumps that were, or masses palpated. Any pain or discomfort?
Nope.
Alright. And your skin on your abdomen looks to be dry and intact, okay? And your temperature is warm. And there was no evidence of your bladder being distended, so no retention of fluid, okay? Alright, and then I do have to listen to your aortic on your abdomen, okay? For any bruits again. Alright, so there is no bruits noted, okay? And then also, I would assess his femoral pulses at this time, but we're not going to do that today. But the normal would be around a 2+ equally bilaterally. Alright, you can sit back up. And you can put your shirt back on if you'd like. Alright, perfect. Have you ever had any injuries to your legs?
Nope.
Hips, ankles, feet?
Nope.
Have you ever had any surgeries on your legs or
Nope.
lower extremities? Okay. And have you noticed any numbness or tingling of your lower extremities?
Nope.
Okay, perfect. Alright, so if you don't mind, I'm just going to alright. So I'm just going to raise your pant legs up a little. So, both of your legs appear to be symmetrical. The skin color is appropriate for your ethnicity. Okay, your skin appears to be dry and intact, free of any lesions or abrasions, and there is no visible edema. Okay, the hair on your legs looks to be evenly distributed. All right, and then I am going to also. So first thing is I'm gonna palpate your knees and your ankles, toes. You tell me if you have any pain or discomfort, okay? And I'm also assessing for any edema of your lower extremities. All right, and then I'm gonna assess your toes. I'm gonna look at your bottom of your feet for any ulcers, okay? All right, and then I'm also, so your nail beds are pink, they're firm, and then I'm going to check your capillary refills too, okay? And then your capillary refills are less than 3 seconds, equally bilaterally, okay? And there was no palpated edema of your lower extremities, so a 0 on your ankles and your feet, okay? And now I do have to feel your popliteal pulse, and I have to assess your posterior tibial and your dorsal medius pulses, okay? So the first one is your popliteal, so I'm just going to assess that by coming in behind, all right, just the back of your knees. All right, so your popliteal pulses were 2+ equally bilaterally, okay? Now I'm gonna find your posterior tibial. Alright, so your posterior tibial pulses were 2+ equally bilaterally. And now I'm going to assess your dorsal medius pulses, okay? Alright, so your dorsal medius pulses were also a 2+ equally bilaterally, okay? And now I'm going to have you push up, all right, and down. All right, you have good strength in your lower extremities, all right, and then I am going to just test the bottom of your feet for sensation, okay? If you feel sharp, go ahead and let me know, okay?
Yep.
Okay, perfect. Alrighty. And then, can I have you flex your feet up and down, side to side? Any pain or discomfort with that?
No.
Okay, perfect. And there was no clicking, popping, crepitus noises noted. Okay. Now, if you can, I'm gonna have you stand up for me. All right, and I'm just gonna have you raise your foot out in front, again, and side to side, and the other side. All right, and can you make a half circle with your foot? Like, all the way around, like, perfect, and the other way? All right, perfect. So you have full range of motion of your lower extremities. There's no clicking, popping, crepitus noises noted. Okay, now I'm gonna just have you walk over here to the corner. All right, come back. All right, how do you feel? All right, your gait, you were normal, stable, no concerns. And then I'm gonna have you put your feet together and close your eyes. All right, open. So your Brownsburg test was negative. All right, and then I am going to check your balance. So I'm just going to have you do slide your heel slide. Yep. All right, so you have good balance. All right, you sit and stable. So if you want, you can have a seat. and I am all done with my assessment on you, and I am going to relay all the information and go document all this to the provider, and he'll be in shortly with you, okay?
All right, thank
Do you have any questions?
Nope.
All right, thank you.
Thanks.